I'm Laura and I study adult nursing T-level at Cirencester College.
Hi, my name's Hannah. I'm also a T-level student here at Cirencester College. This is our patient Susan. Susan's 46 years old and today we're going to be doing some observations on her.
So the 5 observations we take in nursing are respiration rate, the blood pressure, temperature, pulse and the oxygen saturations. The reason we take observations in nursing is that it's because it's critical in knowing if a patient is going to deteriorate and how quickly we can spot it.
We use the National Early Warning Score to determine if our patient is deteriorating.
So in blood pressure you have a score that's a systolic and a diastolic. The average reading we expect is 120 over 80. 120 is systolic and this is when the artery is contracting at the top. And this is the main one we focus on because it can indicate things such as heart diseases and sepsis and things like this. Diastolic is when the heart is relaxed. So how we take blood pressure, with all observations you must take consent first. So is this okay for me to do your blood pressure, Susan? So what you do is you're going to put the blood pressure just across their arm and you want it to be just above their elbow. And it will be tight, so you want to make sure they're aware that it will get tighter and it might be uncomfortable and that they can stop if they want. You want to tighten it enough so you have 2 finger spaces just below. So there we go. So Susan, it's just going to get tighter, but if you want me to stop at any time, just let me know. And you press start and it will do it all for you.
This is a thermometer. This is a non-invasive thermometer. This is what we use to measure patients' temperature. The normal ranges of temperature are 36.2 to 37.5. And so what I'm going to do is I'm just going to press this button and I'm going to ask for consent. So Susan, is it alright if I measure your temperature? I might have to move your hair out of the way. And then put it not too close to the head, not too far away, and then you just press the button again and it should give you a reading. Okay, Susan's body temperature is 36.3, which is it's not too bad.
So now we measure the heart rate and this is also known as the pulse. So this is really good at measuring how good the circulation is, how much the blood is flowing around the body and if there's any irregular heartbeats. So one way we can measure this is with a stethoscope and this is just done by holding on the heart and listening through these ear holes. This is really good at hearing whether the heart rate is at a good pace or if there's any irregular patterns or anything that could be an issue. However, more commonly, the easiest way, if you're not concerned about too many heart rates, we take it through the wrist or through the neck. Now, this is because it's really non-intrusive, so it's easier to take, but also the pulse on the wrist is the furthest away from the heart, so it's a really good indication whether the circulation is still flowing through the body. So you take it, you time it for a minute, you hold it on there, and you're going to wait till you find it and time it for a minute. Now, you're going to, every time you count and every time you feel a pulse, and the average should be 60 to 100 beats per minute. Obviously per person it can change slightly, but that's what we're expecting and this is a really good way. If you can't find it there though, then we might try the neck and the stethoscope. So the last 2 observations we take is oxygen saturation and the breathing rate. An oxygen saturation measures how much oxygen is in the blood. This is a really simple one to do. It's done on this oximeter and you put it on one of their fingers and it will measure how much oxygen is in the blood. So the average score we're looking for is around 97% to 100%. And this is important, ensuring that the oxygen is flowing all around the body to ensure the organs have the correct oxygen to function, which is essential. Perfect. So Susan's is 97%, which is what we're looking for, so that's great. And the next one we've got is respiration rate. Now, this is really important because this can indicate a lot of things about your airways. So we're looking for a nice natural breathing rate, which is around 12 to 20 breaths per minute. And how we do this, we get out our clock and you want to just be looking at the rise and fall. Quite often we get their hand and we hold it there so we can feel that rise and fall in their chest. You'll time this for a minute and you want to be listening out also for signs because if there's shallow breathing or quick breathing, it might indicate things such as blocked in the airways or issues with the heart, and this might require them to have extra support with their breathing.
So adding up Susan's score, it turns out she has a good score which means that she's not deteriorating and we won't need to check observations for another 2 hours. However, if she was deteriorating, if she had a high score, we would have to be doing observations every 30 minutes just to make sure nothing serious is happening with her.
Yeah.